In 2021, every 37 hours, someone died of a fentanyl overdose in Denver. We also know that the problem is getting worse as fentanyl misuse becomes more pervasive. The impacts of fentanyl are not just felt in lost lives and overdose deaths. The impacts are also felt on streets, where the proliferation of this drug has fueled crime and impacted safety in our neighborhoods and downtown. The opiate epidemic, coming on the heels of a global pandemic, is our current health crisis.
I'm also a mother, whose son Mark died of a preventable heroin overdose after fighting with everything he had to overcome his addiction, a death that could have so easily been avoided. Mark could and should still be here. I would have my son, his sisters would have their brother, his wife would have her husband, his family and friends would have them in his life, but more importantly, his son Maxwell would have his dad.
From January through May of this year, we already have seen an 8% increase over last year. And we must be honest about how drugs, particularly fentanyl, have impacted our community. Not too long ago, I sat with families and I listened to their stories. No other public issue makes me more anxious than this one. This crisis permeates everything we're trying to deal with in this city. Crime, homelessness, healthcare, safety in our communities. Denver is committed to tackling all the sides of this problem, from getting dealers off the streets to providing a path for those using substances and helping them on the road to recovery. And it's also all of you who are in this room today, the folks working in public health, who are on the front lines of this crisis. And we have to be suffocated with the desire and effort to provide you with the tools and resources you need to help solve this problem. Over the next 2 years, Denver will receive its first $8 million from a national opiate settlement. I am committed to seeing these dollars directed toward supporting service providers and improving capacity at treatment programs. Our public health officials are also prepared to help expand services, including counseling and medicated assisted treatment, and we're working to ensure a full continuum of care for people experiencing addiction, including covering costs of services when personal finances and insurance fall short, and expanding our mobile response teams to meet people where they are. That is vitally important as we move forward together as a community, simply to save lives. Thank you all for being here. Thank you for standing in the gap for our community.
I want to ask all of you to program a number. It's the number for the Colorado Crisis Services Hotline, where people are waiting. Subject matter experts are waiting to talk to people who are struggling with either mental health or substance misuse challenges. We all need to have that number. That number is 844-493-8255. You can also just text the word TALK to 38255, and a counselor will respond and connect you with the services that you need.